This meeting is being recorded.
Okay, thank you everyone for joining tonight's webinar, Climate Change and Sustainability, Leadership and Action from Australian Doctors. Tonight, the AMA and Doctors for the Environment Australia, DEA, welcome everyone to the webinar. I'm Steve Robson. I'm the newly elected Federal President of the AMA. I want to begin by acknowledging the traditional custodians of the land that I'm presently on, the Ngunnawal and Ngambri lands, and I extend my acknowledgement to wherever you may be dialing in from this evening, and paying respect to elders past, present and emerging all around the country. And I'd especially like to acknowledge and welcome Aboriginal and Torres Strait Islander colleagues who are joining tonight's event. Shortly, we're going to be handing over to the Federal Minister for Health and Aged Care, the Honourable Mark Butler. And also I want to give a special welcome to Australia's Chief Medical Officer, Professor Paul Kelly, who's listening in this evening. Welcome, Paul. As some of you may know, the AMA and the DEA declared climate change a health emergency several years ago, back in 2019, and we've committed to net zero healthcare sector by 2040, with an interim goal of an 80% cut to emissions by 2030. This is the second annual AMA DEA webinar on climate change and sustainability, and we're so pleased to see such a growing interest in the space from government, our members, and the healthcare sector in general. Last year's webinar led to an open letter signed on by medical colleges to the then Prime Minister, urging the Australian government to significantly lift its commitment to the global effort to bring climate change under control in order to save lives and protect health. And this year we've asked medical colleges to sign on to a communique which acknowledges the extreme risk posed by climate change both to global health and to the health of all Australians, and our duty of care to act urgently. Signatories to the communique will be supporting a commitment to net zero healthcare system by 2040, the development of a national climate change and health strategy, which I'm pleased to say the new government is committed to, the development of a national sustainable healthcare unit, further education of current and future doctors to mitigate and adapt to health impacts of climate change, and collaboration on climate change mitigation strategies for populations most at risk of climate-related adverse health effects, such as Aboriginal and Torres Strait Islander peoples. We're pleased that all medical colleges speaking tonight have signed on to support the communique. Well done. We have a great and exciting line of speakers tonight, in addition to the Minister, and they'll be talking to their expertise in climate change and health from different perspectives and different specialties. We have speakers from 11 medical colleges to give us an update on their climate change and sustainability initiatives and issues. But first, a bit of housekeeping. We welcome questions which can be posted in the Q&A section. The questions with the most votes will be answered after the presentation. There's also a chat function if you have any comments that you'd like to post on that along the way. We're recording the webinar tonight, but if any speakers would like to opt out of recording, make sure you let us know. And lastly, a friendly reminder to all speakers to turn off your microphone and video when next presenting. So I'm just going to check in with the team if we've seen the Minister as yet. Apparently not. Not quite yet. So in that case, I'm going to hand over first by introducing Professor Nick Talley, who needs no introduction. He's been the Editor-in-Chief for the Medical Journal of Australia. He's an internationally renowned gastroenterologist, and he'll be speaking to climate change and health, medical advocacy and leadership, a duty of care.
Steve, thank you very much, and thank you to all my colleagues for being here, and also thank you for inviting me to be part of this. If I could have my first slide up, please, that would be great. Thank you. So I'm going to talk about medical advocacy and medical leadership, and I'm going to make the argument that every single one of us, every single medical practitioner, every health professional has a duty of care to be involved here directly and indirectly. And I'm going to highlight that I really believe we are in a health emergency. This is going to be a very long-term emergency, and we need to be very well prepared for the problems we're going to see, we're already seeing from climate change. So again, thank you for the invitation to speak about this. Next slide, please. So I also want to acknowledge the traditional owners of the lands on which we meet today and pay my respects to elders past and present. Next slide, please. So we all know climate change is serious. We've had the IPCC report, which just got released recently, which has really said there's absolutely no doubt about the science. Global warming is occurring, it's human-made, and it's a significant problem. And we're going to see all sorts of more and more serious events over the next coming years and decades. This is beyond dispute. No one argues about this issue at all. Although, as I'll talk later, there still remain some people who seem to believe, and that includes some of our colleagues, who seem to believe this isn't such a serious problem. And it's a great pity that climate change and the health impact of climate change became politicised in this country and still in some quarters is politicised. Next slide, please. I'm going to talk about a couple of the health issues just briefly, because I think sometimes these are less well recognised than perhaps they should be. So let me talk about the bushfires and, of course, bushfire smoke. We really do now know that bushfire smoke is a huge public health problem, and it's all related to these tiny particles that can penetrate deep into our lungs, which are invisible and which affect us when bushfires occur, whether we're in the bushfire zone or anywhere nearby. There are good data that hospital admissions, ambulance calls, and all sorts of other issues are linked to bushfire smoke directly. And also we know that these can cause mortality and morbidity, with problems not only in the lungs, but also in the cardiovascular system and in other in other parts of the body. A very serious issue indeed, and again, under-recognised by the public to some extent, unless the bushfires are really obvious, as occurred in 2019, as shown on the photograph here in Canberra. But regardless, an issue that's so important. Next slide, please. And we published some work in the MJA about the hourly average PM 2.5 levels, these tiny particles, in the Sydney region in December 2019 around the bushfire problem that we had then. And I want to emphasise the problem is there is no safe level of PM 2.5. In fact, any exposure provides a risk, and the more the exposure, the more the risk. And it's quite striking across Sydney in this example, but also, of course, in other parts of the country. It's quite striking the levels of PM 2.5 that were seen around this bushfire event. And obviously, this is going to get a lot worse, and the health impacts are going to be more and more serious. Next slide, please. I also want to mention coal, because it's not just about burning coal. The problem with coal is mining it, hauling it, preparing it, burning it, getting rid of the waste. All of these activities, all of them, contribute to the mortality of coal. It is really the silent killer. And again, surrounding the PM 2.5 risk that occurs from the pollution that will happen with the handling of coal. It's not just that particular matter, but it's certainly one of the significant factors. And there are reasonable calculations about the mortality associated with just having coal handling and burning and waste removal. And while one could argue, well, how important are these mortality numbers? They are going up, they are significant, and they're certainly going to worsen. So coal is not a healthy product to be dealing with, even if you don't burn it. And that is a significant problem. Next slide, please. And of course, the other issue that we face and will face more of is extreme heat. We know that the globe is warming, no doubt about this. And the real problem is adaptation to heat is much, much more difficult than adaptation to cold. And in fact, the mortality associated with extreme heat is more of a problem than cold in general. And we're going to see more and more of extreme heat, not just, of course, in this country, but around the world, at least in many regions of the world that will be affected. And some parts of the globe will probably be difficult to inhabit, even with air conditioning and our modern technologies. Next slide, please. So there are other health risks as well, but the issue for us is we are still largely not well enough prepared for both the mitigation part of this and also really prepared for the problems that are coming our way in the coming decades. And it depends, I guess, on how severe global warming becomes, and I'll come to that in a moment. Every year for the last several years now, the MJA Lancet Countdown has been published, which is a report card of how we're doing on climate change and health. And the latest report will be published in a couple of months in the Medical Journal of Australia. And basically, it's a fairly gloomy read at the present time, as you might expect. Next slide, please. Now, we have had recent wins. There's no doubt about this. The new climate bill that was passed through the House of Reps this year, which is enshrined into law, greenhouse gas emission targets, is a very worthy law. And I'm sure many of you are very pleased that has been passed. But I want to point out the exact details of how we will actually reach this target, and obviously, preferably well exceed the target, are at least somewhat unclear. And it will not be an easy road to get even to this level of cuts, let alone the level of cuts we will really need to deal with climate change in the future. Next slide, please. And the reason I say this, and we published a paper on this in the MJA a few years ago, but there's a lot of other work that's also really come to the same conclusion. The trouble is, we know that we are warming more than expected. We know we are going to overshoot the 1.5 degree or increase that we've already expecting, and that seems very likely. Steve.
Nick, it's Steve Robson here. Sorry to interrupt. We have the minister on the line now.
Perfect. Let's bring the minister on, Steve.
So I'm very sorry to interrupt, but I want to introduce the Honourable Mark Butler, Federal Minister for Health and Aged Care, who's going to speak to us before quickly getting on a flight. So sorry, Nick, but we'll throw to the Minister.
Thanks so much, Steve. And I'm sorry, Nick, for interrupting that presentation. It was fascinating, but I was in the audience and just having some trouble connecting to you as a participant, which is why I wasn't able to take my spot at the right time. But I'm so delighted to be able to say a few words about this area, an area I've been passionate about for many years now, having held the climate change portfolio as a minister and then the shadow minister for about 8 years over the period from 2013 to very early last year. As Nick has pointed out, this is now a very important focus of health bodies at a national and global level. At some time since the World Health Organization described climate change as the greatest threat to public health in the 21st century and indicated that as many as 250,000 people would die every year from 2030 to 2050 just from the direct effects of global warming. We know the dislocation, economic and social, will be enormous, particularly to low-lying countries, small island states in our own region, and that will have huge physical and mental health impacts as well. And the impact here in Australia will be profound in a continent that already pushes us right up against the limits of human tolerance, particularly, as Nick was saying, in relation to heat. We're going to see much more heat stress, many more heat-related deaths. The impact of more frequent and intense extreme weather events across our continent will be quite profound. And it's been projected now for some time that vector-borne disease will creep steadily southward. For example, the exposure zone for dengue fever is expected to reach as far south as Rockhampton by the middle of the century, and even northern New South Wales by the century's end. But we're not going to have to wait until we see these impacts. As you all know, we're already seeing them. The Black Saturday bushfires were some of the very early examples of good recorded data on this. In addition to the tragic deaths caused by those bushfires themselves more than a decade ago in Victoria, there were about 374 additional heat-related deaths as a result of the heat wave that drove the bushfires, a 700% increase in ambulance call-outs for cardiac events. So we know that this is already impacting Australia, and it's going to be much worse in the future, even if we are able to deal with some of the mitigation objectives and ambitions that we've signed up to at an international level. Now, the first thing obviously to do, as Nick was pointing out, is to take this seriously at a national level and put in place real science-based targets for emissions reduction. That's not easy for a country that's been so carbon intensive for so long, but it's something I've been advocating for many, many years. But in addition to that, as Nick pointed out, we need to start to move to sector-based strategies, whether it's in mining, transport, manufacturing, energy, and many besides, to start to reduce in a practical way the carbon footprint of each of those sectors. And the health sector is no different. The health sector is a major producer of emitters. And as Steve pointed out in his introduction, many of the peak health bodies, including the AMA, some of the colleges, the DEA and others, have for some years now put in place ambitious targets to reduce the direct emissions footprint of the health sector. But that's just one element of a climate and health strategy. I've been an advocate of a national climate and health strategy for many years. It's been Labor Party policy since I was the Shadow Climate Change Minister. And we took it to the last election again as a commitment to our period of government if we were successful at the election. As well, I've said that climate change would be a national health priority, and that's something I've already started to discuss with my state and territory health ministerial colleagues who are very keen to go down this path as well. And there are three areas I think we need to work on. The first I've already talked about, which is the direct emissions footprint of the health sector, and that's important. The second is to prepare the health sector for the climate change impacts that we know are already baked into the system. We're going to see them in our regions, in our cities. They're largely heat related, but they will be broader than that as well. So that's got to be the second element of the strategy. The third element that I'm really excited about, though, as a long-time advocate of climate action, is our ability to maximise the synergies between good public health policy and good climate policy. I'm in Canberra right now about to leave, but I'm in the town where Tony McMichael, who is really one of the great intellects in this area, wrote so much about those great synergies between public health policy and good climate policy. You know, good clean energy policy is not only good for the climate, it's good for public health because of the reduction in particulate pollution. And good active transport policy is not only good for the climate, but you know better than me, it's good for public health as well. And as someone who gave up eating meat many years ago because of climate, we know that good dietary policy is not only good for the planet, but for individuals taking that decision if they choose, it's also good for their public health. I remember watching President Obama in his second term, the first term really being focused on Obamacare. But as he moved into his second term, this great communicator, great campaigner, hardly ever spoke about climate change policy without putting it through a public health lens. That was a really important lesson for me. In a country that so highly respects its public health leaders, we should be doing more to connect those two discussions, because I also know that we're a country where climate change is still a hotly contested issue. And the more weapons we can bring to the battle of winning that climate change policy war, the better as far as I'm concerned. So we're committed to putting in place this strategy. I've already asked my department for advice about how we can do that, how we can implement our election commitments. As I've said, got really good buy-in already from the state health ministers and territory health ministers as well. And I'm just so delighted there's real momentum in the health sector itself. So congratulations to AMA and DEA and the colleges, as well as the MJA for putting on this webinar. I'm sorry I can't join you for the duration of it. My plane is now boarding. So I'm literally being pulled out of this room by my staff now, but I wish you all the best and really look forward to this discussion continuing.
Thank you so much, Minister, and have a great flight. Thanks for your time this evening. So we will cross now back to Professor Talley. And sorry to jump in the middle of things there, Nick.
No, that's fine, Steve, and thank you very much. And it was great to hear the Minister's comments. If I could have slide 10 up again, please, if that was okay, that would be terrific. Thank you. So, as I said, the planet's warming. We already know we're going to hit 1.5. The problem is the more recent estimates suggest we're going to overshoot this. And in fact, it's even worse news, at least looking at some of the reports recently. There's even concerns that 1.5 is completely unrealistic and we're looking at 2 to 3 degrees. And that raises a really serious point. Getting to net zero is a great goal for the globe. It'll be very hard to do and unfortunately may not be enough to overcome the issues we're going to face. And the idea that we'll need to find ways to take out CO2 from our atmosphere, for example, are being seriously discussed, although the technology to really do this on a mass scale, at least to the best of my knowledge, isn't yet available. And I think this is quite frightening. And I think we need to recognise this is worrying our young people in particular very, very much, our children and others. And I think it's a serious issue that we must face. Next slide, please. I also want to point out, as I talk about wins, there are still those who are not following the script here and very much are fighting this idea that we need to do a lot about climate change, not only for health reasons, but for the planet's ecology and safety. And at least according to recent reports, Australia is one of the global hubs for climate misinformation. And we still see news reports like I've shown on this slide when it got cold in July and snow was falling, that in fact, why should we be worrying about things like climate change if that's occurring? Quite ridiculous newspaper articles that really mislead and confuse those who are trying to understand what's going on with climate change here and in the world. Next slide, please. And look, globally, I think we should be worried too. It's not just about Australia here. There are clearly serious problems occurring with lack of leadership and also lack of meeting targets in a real way. The UN Secretary General was very blunt when he basically said, we're being lied to by leaders around the world. Not, of course, all, but certainly some. And this is very worrying. And I think we need to hold our leaders, our political leaders and others to account here, whoever's in power, because it's just too important to do otherwise. And I think we still have lots of promises and not enough action, not just here, but around the world. Next slide, please. So we do a lot of talking as health professionals, but we need to do more than just talk if we're going to avoid the outcomes that we are seeing now and we worry are going to substantially increase the bad outcomes over the coming decades. So that brings me to the advocacy issue. Next slide, please. So advocacy on climate change is something that many of us on this webinar, I'm sure, feel strongly about. But I would argue across the profession, there remain very large segments who really don't see this perhaps as such an important problem. And that's something we need to change. Next slide, please. So I ask the question of all of you on this webinar tonight, is your college or your professional organisation doing enough about climate change and health? And are you individually doing enough? We know that we can mitigate some of the bad outcomes that we all have talked about tonight, but the problem is we're still overall going to see a significant worsening of health because of climate change in the coming decades. So it's clear no matter what we're doing now, we need to do more. Next slide, please. It's been argued, and I agree with this argument, that we as doctors have a duty of care in terms of climate change and health. This is a healthcare emergency. I think most people who know the data would agree that's the case. It's going to be a long-standing emergency, and we have responsibilities we cannot shirk because of that. We need to educate ourselves and our patients and our students. We need to grow research in the area because there's lots we still don't know, and research can change the world if we do it well. We need to build resilience and drive healthcare resilience going forward. And there are many ways we can do that individually and in other ways. We obviously need to promote decarbonisation, and we need to use our voices because our voices matter, and doctors speaking out, they are listened to. And it's so important that that occurs right across the sector and not just from part of the sector. Next slide, please. Business is onto this. They know this is really important for their bottom line profits, if nothing else. And business is talking now about not when they'll do something or what they'll do, it's how they'll implement success here in terms of ensuring their business models also thrive as climate changes across business sectors occur. And this requires leadership at every level, just like it requires in the health sector for us to do something, leadership at all levels. Next slide, please. The NHS is showing leadership, and I haven't got time to talk about this in any detail, but it's clearly been working on a systems-wide approach to reduce emissions from the healthcare system, which are substantial, as the Minister already mentioned. And the success of this is quite striking because not only are they reducing emissions, they're saving money for the system, which can be replugged back into healthcare. So it's a win-win if we can make it work. Next slide, please. Again, they've been the first to commit, the NHS, to many different strategies, including ensuring their trusts have net zero strategies and boards deliver. They've changed a number of their services. They're building support internationally as well. And again, it's very impressive, although one could argue this needs to happen right across the globe for real impact to be seen. Next slide, please. So I would like to ask those who work in the hospital system, for example, in Australia, what's your hospital doing about emissions and health? And who's taking action? And if no one's taking action, why aren't they? And what about you taking action? I know what's happening in my hospital. They're working very hard towards a very aggressive target for reducing emissions by 2030. They want to be carbon and waste neutral at the John Hunter Hospital by then. They're working towards this and certainly making some strides in terms of some successes here. There's a lot more to do, but it's still one way to show leadership. But that's just one healthcare district. We need all healthcare districts to be doing this. And at the moment, at least as far as I'm aware, it's patchy, with some areas really doing a lot and some doing much less or perhaps nothing. Next slide, please. So I think as health professionals, we can lead by example, and we can actually make a difference to the healthcare system emissions as well directly if we act together. And I've listed here, it was written in the MJA, some ideas that I had about this. They're not very original, but they're certainly ideas. And they're really consistent with this concept of a duty of care that we have as healthcare professionals, no matter what kind of job we have in the healthcare system. Next slide, please. So I often ask myself how I'd answer this question if I'm asked it in the near future. What did I do about climate change? What actions did I take that made a difference? And I hope I'll be able to answer that I've done something useful. I'd like to do more. I believe none of us are doing enough, but I certainly like this quote from the Emergency Medicine Journal, which suggested in an editorial that you'd like to be able to say, we acted with foresight, with courage, and especially with haste. Thank you.
Nick, thank you so much for a fantastic overview of the science. And I was delighted to see a number of the papers that you showed us there were from the MJA. That's extremely good to see. I'm a little bit embarrassed that my own college is not a signatory, but I'll be onto that very shortly, rest assured. And I think one last thing, your comment about people denying science is very worrying. And that, I think you and I should have a whole webinar on how we can engage public to believe scientists and to believe science. So, Nick, thank you so much with that. Our next speaker is Professor Alexandra Barrett, who's Professor of Public Health at the University of Sydney. And she's lead investigator on the Wiser Healthcare and Healthy Environments and Lives National Network. It's delightful to have you here, Professor Barrett.
Thank you so much, Steve. I hope you can all hear me. Maybe somebody could give me a thumbs up or something to indicate that you can hear me.
You're all good.
I'm all good. Beautiful. Thank you. It's really a great pleasure, and thank you so much for the invitation to be here. Fantastic event. I'd like to say that I'm joining from Gadigal land, and thank you, Steve and Nick, for the acknowledgements of country. And as you've said, I'll be speaking on behalf of Wiser Healthcare, which is a research collaboration for reducing medical overuse, for reducing over-testing, over-diagnosis and over-treatment. Next slide, please. So what I'm going to do is just talk a little bit first about low-value care and medical overuse, give some examples, and then talk about the carbon footprint of low-value care, and finish up with a few suggestions for moving forward and some take-home messages. It's really fantastic, I think, to have had that introduction from Nick, because so much of what he said is will reinforce the points that I'm going to make. And I think I 100% agree, like there's something that all of us can be doing. So medical overuse, I think everybody's probably familiar with the idea. It's the provision of medical services for which the potential for harm exceeds the potential for benefit. And low value care is a similar kind of concept where care provides little or no benefit and also increases the risk of harm and doesn't provide proportionate benefit for the costs involved. Next slide, please. So a couple of examples. These are two well-established examples of low-value care in Australia. The first example is vitamin D testing. And can I just say, I'm not meaning to point the finger of blame at anyone here. These issues of low-value care, it's really system-wide, and we are going to need system-wide solutions. And as we were saying before, all of us have got a role to play in that. So vitamin D testing, astonishingly, there are over 4 million vitamin D tests requested and subsidised through Medicare every year. In 2020, it was more than 4.4 million, at a total cost of more than 100 million. There's a great study which looked at 1.5 million medical records, and from this work, they were able to work out that about 76% of those vitamin D tests do not meet any of the Medicare indications for testing. So we can be pretty confident that they're examples of low-value care. The lines on the right-hand side there just show that in 2020, the number of vitamin D tests was even higher than in 2018 and 19, and it's increasing year on year. Thanks. Next slide, please. Another example of low-value care is knee MRI scans. Similar sort of picture. You can see the green line there is the number of MRI knee scans per year, and 2013, when it was made possible to request the scans in primary care as well as specialist care. These scans are that you can see there, they're only amongst people aged 55 years and over. And similarly, there was a study which looked at the indications and concluded that the vast majority of them are probably not indicated on the clinical data. And there's good research that shows that a lot of people in this age group will have abnormalities, and having an MRI doesn't really help. And you would be just as well off making the diagnosis of osteoarthritis on a clinical exam or with a plain film X-ray. Next slide, please. So we've been doing work at Wiser Healthcare looking at the carbon footprint of common things that are done in health. Of pathology tests, 5 common pathology tests, and we've also done carbon footprinting of common imaging tests. We use a method called life cycle assessment, which is the best way, the most accurate way of measuring carbon emissions from a product or service. What it does, as the name implies, life cycle assessment, is to look at the whole process of a product, from the raw materials to manufacture, to distribution, to use, and to disposal of that product. And to give you the summary, it's about 100 grams of CO2 emissions per blood test taken, and about 1 kilogram of CO2 emissions per MRI or CT scan taken. So we can use those data. Next slide, please. For example, in relation to vitamin D tests. So you'll recall that I said more than 75% of the vitamin D tests are low value or no value tests. All of this information to construct a sort of sustainability assessment or triple bottom line assessment. So we know there's no health benefit from those 3.4 million tests, vitamin D tests that were done in 2020 that are low value. They have a cost of more than $87 million to Medicare, and they produce around 42,000 kilograms of CO2 emissions, which is about the same as driving from Sydney to Perth 60 times. Next slide, please. So if we do the same thing for knee MRI scans, we'd get the same triple bottom line assessment. Again, there's no health gain from those scans that are low value scans. The cost is over 36 million, and the carbon emissions are over 96,000 kilograms of CO2 emissions, or about the same as driving Sydney to Perth 136 times. Thanks. Next slide, please. So those are just 2 examples of low value care, but as I'm sure you're all familiar, there's lots of examples of low value care in modern healthcare, unfortunately. And I'm very grateful to my colleagues, Jeffrey Braithwaite and his team, who have done a synthesis of the evidence, and they estimated that about 30% of all healthcare is low-value care. About 10% is harmful and about 60% is effective. So what does this mean in terms of the carbon footprint of low-value care as a whole? Next slide, please. So we know, and the other speakers have referred to it, that the total carbon footprint of Australian healthcare is about 36,000 kilotons of CO2 emissions per year, or about 7% of the national CO2 emissions. I think a really important thing to bear, the majority of that comes from clinical care itself. It comes from pharmaceuticals, from tests, from procedures, from devices, all the things that of medical care. The minority come from buildings, energy, electricity, gas. So in order to reduce the footprint of the health sector, we actually have to change the way clinical care is delivered. Next slide, which will build on that one. So if we now combine these two pieces of information and we think about the place of low-value care, so think about that 60% of the carbon footprint that is clinical care, we can divide that into the portions of the footprint coming from effective care, from low-value care, and from harmful care. And the bottom line is, next slide, please, that the total footprint of low-value care in Australia is over 8,000 kilotons. So if there was one single thing that we could reduce the carbon footprint of healthcare, it would be to cull low-value care. Overnight, we could cut perhaps 8,000 kilotons of our total footprint. Next slide, please. So let's think about the bigger picture here. So Nick gave us a really fantastic overview of what it's going to be like as we face the impacts of climate change. We know that there is going to be increasing illness and injury from the impacts of climate change, from prolonged heat, from bushfires, from extreme weather. All of that is going to increase demand for healthcare. And that in itself will drive further health system pollution, more carbon emissions, more waste. And that then feeds in a positive feedback loop to create more climate change and more demand. So we have to break this spiral, and we have to do that by reducing demand. Next slide, please. So low-value care is the same in its impact in the sense that it also increases demand. So we have to find ways to reduce demand. And again, one way of doing that is to reduce low-value care. Next slide, please. Thank you. Next slide. So we've done also some work. We did a systematic literature search and we looked for all the drivers that have been identified of medical overuse and overdiagnosis and overtreatment. And you can see down the left-hand side of this slide. So they operate at all levels. As I said, this is really a system problem, and I'm really not wanting to point the blame at anyone because we are actually all part of the problem here. And likewise, we're all part of the solution. So we really have to think about addressing this at the macro level, thinking about things like the culture in which we operate. At the meso level, so thinking about how we operate in groups, in colleges, in local health districts, in hospitals, and at the micro level, thinking about one-on-one patient encounters. There's a host of drivers, but likewise, there's a host of solutions. And I think it's really important to look at that list and to recognize a couple of things. One is there's no magic bullet here. There's no single thing that we can do that's this problem. But It also means that there's something for everyone. There's something that we could all be contributing to on that list of solutions that would help to reduce low value care. And that in turn will help reduce demand, and it will help cut the carbon emissions of the health system. Next slide, please. So I'd like to leave you with a couple of messages. The first is the carbon footprint of low value care is really significant. It's really significant. And this is yet another reason to add on to the fact that it doesn't deliver any benefit, the fact that it's costly. This is yet another reason why we all have to get motivated about reducing medical overuse. Next one. The second is not only it increases the carbon emissions of the health sector, it also drives healthcare demand. And we just really don't have the luxury of that anymore. And the third point is, thank you, is that it's not a single solution problem, which is, I think, good news, because as Nick was saying, we all have to look at ourselves and think, how am I part of the problem and how can I be part of the solution? Thank you very much. Next slide. I'd just like to finish by acknowledging all the fantastic people that I work with. So many people have had a part in the many different pieces of research that I've referred to there. And so thank you to everyone. And please visit us at wiserhealthcare.org.au. Thank you.
Thank you so much. That was an absolutely fantastic talk again, and an enormous amount of food for thought there. I'm now going to hand over to my friend, and I had some fantastic chats a week or two ago at the AMA National Convention with Dr. John van der Kallen, who's the chair of DEA. And I'll hand over to John to talk us through the medical colleges. Thank you, John.
Great. Thanks very much, Steve. And congratulations to you taking over the AMA presidency. Thank you so much already for these fantastic presentations, and looking forward to the next section where we get to hear from 11 colleges on what they're up to and what their plans are. Just briefly, for those who don't know, Doctors for the Environment, we're an organisation of doctors and medical students throughout Australia. Over 2,700 members who really advocate for a clean environment so that we can protect our health. And climate change, of course, is going to be one of those big issues that is affecting our environment and consequently our health. So we've got a bit of an action-packed session now because we've got 11 colleges. So everyone knows that they've got 4 minutes each. I will give a 30-second warning for those who might need that, just so that they can wrap up to go. So our first college is the Australasian College of Dermatologists, and we've got Dr. Austin Anderson, who's dermatologist and member of the College of Dermatologists. So over to you.
Thank you, John. I'm speaking from Whadjuk Noongar country today, and first I'm going to discuss a couple of examples that are emerging on the environmental impacts on skin disease that are associated with climate change. And then I'm going to discuss how our college is acting in this space. This first slide shows two articles that are articles from one of the major American dermatology journals. The first one was published mid last year, and it highlighted the effect of wildfire air pollution on presentations for atopic dermatitis and itch in both adult and pediatric populations. And this study showed that there was an increased presentation rate for both adults and children with atopic dermatitis and itch to a tertiary dermatology centre. The second article there also shows that psoriasis seems to be exacerbated by air pollution. And so we need to be doing more research in this space in Australia, of course, as well. Thank you. Next slide. One of the major presentations in dermatology, and I know also a huge presentation in general practice and in plastic surgery as well, is skin cancer. And so it would be really great if we could predict how climate change will impact on UV levels and how this will all correlate to skin cancer presentations. But it turns out that when I've been researching this, the science in this space is actually quite complicated. The Montreal Protocol that has addressed ozone depletion is improving the state of our ozone layer. And so that reduces the UV radiation that penetrates to our skin. But climate change will impact UV also. So increased temperatures, for example, will affect human behaviour, and also other effects of climate change, such as cloud cover and pollution, will also affect the amount of UV that penetrates our atmosphere onto our skin. So probably there'll be some populations at some times that will experience greater UV exposures, and some populations that will experience less UV exposures at some times as a result of climate change into the future. Thank you. Next slide. So what is our college doing in this space? Well, the main area that we worked on this year was hosting a Skin and Climate Summit, which was held in May 2022. It was a virtual summit, and we had some really outstanding speakers present to over 80 fellows that attended, and that's quite a good number for our small college of 550 fellows. We also held sustainability sessions at our annual scientific meeting in April, and also discussed the importance of acting in this space at our ethical session at our ASM as well. And we're really happy that our college has formally entered the advocacy space and is now a signatory to the AMA-DA communique that is being organised as part of this conference or this discussion. Thank you. Next slide. So over the next year, we'll be working on increasing our participation in research in this area. We will create an online discussion group for dermatologists to share ideas in this space and to support sustainability efforts in our own practices and in our college as well. And then we'd like to increase the profile of climate change and skin health at our annual scientific meeting and host a discussion on this in a plenary session next year. And we also plan to develop educational resources for our fellows. Thank you.
That's 30 seconds as well. Austin.
Thanks, I'm all done.
Well done. You're a
under time.
Very much so. Well done. Excellent. Oh, great to see what the college is doing there. So next, we're going to hear from the Australasian College of Emergency Medicine and Dr. Claire Skinner, who is the current president.
Thanks very much, John. And as I'm sure you know, emergency physicians can shove a lot of stuff in between the 2 minutes you get in a cardiac arrest cycle, so I should be fine with the deadline. I actually worked in an environmental science lab before I did medicine, and it's pretty disappointing to me that more than 30 years later, we're still having the same conversations, but I'm really glad that we are, and thank you for the invitation to speak tonight. I work at Hornsby Hospital, which I'm proud to say is the first solar hospital in Australia, fully solar. And I also live and work on the lands of the Darug people along the Hawkesbury River. And we are very much soggy and affected by climate events at the moment and have been continuously for the last few years. Thanks, Alex, for your talk about low value care and choosing wisely, because that very much resonates with the emergency medicine philosophy of doing as little as you need to make the clinical decision that's required to make a difference. And I think that's one of the big things that we as emergency physicians can contribute to this. Now, you can probably see from my slide that ASIM's been in the climate advocacy space for quite a while now. We've had a public health and disaster committee for a long time. They had a climate working group within them. And in 2019, at our annual scientific meeting, we marched through the streets of Nipaluna, Hobart, declaring a climate emergency. And that was our first big entree into the advocacy space. For me, the links between climate change and emergency medicine are really obvious. We're the front line of the disaster response when things go wrong, as you will have seen, in the northern rivers of New South Wales and southeast Queensland recently through the floods, the bushfires at the end of 2019, and of course through COVID, where emergency medicine has been absolutely there, driving policy and looking after the community. We're also the last resort of the health system. So all disaster mitigation ends with a message to, if you're concerned, go to ED. So there's no way that we're escaping that we're central to the climate response. And for that reason, climate advocacy has been very important to us. We have seen presentations increasing to emergency departments. As Simon Judkins, a former president, has put in the chat, as we get more and more overloaded, the temptation becomes to overload our patients with low value care. So as our systems get overloaded, our clinical decisions sort of wear down and we tend to be risk averse and we tend to order things from the outset. So I really do think that low value care is one area we've got to contribute. I just wanted to point out, and I probably need a new slide, please, forgot to say. So look, I've talked about a little bit of that in emergency medicine, not only are we clinically part of the response, but we also have a really important place in the system of advocating for more marginalised and vulnerable patient groups who seek emergency medicine as the only place in the system where they can find care. Can I have a new slide, please? So ACEM actually has been working now for years, but has recently launched a climate and environment strategy, and it's got several pillars which I'll quickly run through. So leadership, which is around the fact that we must be leaders in the health space around this. We have a sustainability matrix which we're implementing at the college level and which we can also use to advise people in their own EDs about how to have more sustainable practice. We have a research arm to this, which is how we do research to show the impacts that climate change is having on emergency departments and also what we can do to reduce our climate impact. And as I mentioned earlier, we're heavily involved in advocacy. At the moment, mostly in partnership with other groups, but increasingly we're also putting in submissions to government in our own right and doing things in our own right. I have another slide after that, I think.
Yep, you've got 30 seconds.
So we're working in partnership. So particularly it's nice to partner here with the AMA and the DEA through the Climate and Health Alliance and through the Better Futures Forum have been our main places there. We see education as critical here. It's come up in the chat, but we think that all of our members and trainees need to know the basics of climate change and how that will impact on emergency medicine and build that into their practice. And of course, we need a culture where this is important and we make sure that sustainability is always part of what we do. So we want to be in a place where individuals at home and at work can prioritise climate-based decision-making, that we are sustainable in our EDs and our hospitals, and that we as a college are sustainable. We've divested our banking to more climate-friendly organisation. Our investments must be climate positive, which is really good. And I want to be in a place where we know that never can we just think about the individual patient in front of us, but we've always got to think about the impacts that our care will have on the broader system and on the climate, because that's actually all part of the equation. So thank you for having me. 4 minutes is not enough. I would hope that we can all, through talking, get a little bit smarter and more targeted in our advocacy, because I think the time has come now for really targeted recommendations so people know exactly what we need to do. And thank you for the chance to talk.
Excellent. Thanks very much, Claire. Very good messages there. So the next is Rob Fair, who's going to be representing the Australian College of Rural and Remote Medicine. He's a rural generalist and he'll be speaking on their behalf. Thanks, Rob.
Thanks very much for having us. My name's Rob Fair from Bairnsdale, Victoria, coming to you from Gunai Kurnai country, representing Australian College of Rural and Remote Medicine. It's great to hear all these inspiring presenters and to confirm once again that we're all on the same page. And really the message from ACRRM, next slide please, is that we recognise climate change as a rural health emergency as well as a global health emergency. We feel the impacts of climate change in rural and remote Australia, I think, as much as anyone. We call for a global emergency response and response from all levels of government in Australia to mitigate the impacts of climate change on our rural and remote communities. And we consider that Australia's response to date has been entirely inadequate. In particular, we call on the Australian government and all levels of government to apply a rural proofing lens to climate change policy. And if I can just reference Helen Haynes, the member for Indi, Country Victoria, who you may have noted introduced an amendment to the climate change legislation this week, which included a requirement to consider the impacts of climate action on rural and remote communities. And of course, thinking about health inequity, as Claire was referring to before, some of the patients we see are amongst the most disadvantaged communities in Australia, and this is fundamental to health equity. Next slide, please. So we see an incredibly broad range of impacts of climate change across our communities. I live in East Gippsland, which was ravaged by bushfires 2 years ago. We have also had floods, as Claire described, across much of rural and remote Australia. Our farmers are reliant on primary agriculture for their income in many places and vulnerable to drought, to water security issues. and in far northern Australia are also impacted by cyclones. So our communities are disproportionately affected, and likewise our members are disproportionately affected because we notice significant impacts, health impacts, and in particular we note the impact of in terms of mental health consequences of floods and bushfires. We notice really severe forms of post-traumatic stress disorder after bushfires and floods as a result of significant environmental change, loss of homes, loss of attachment to place. And really, as rural doctors, we do develop close attachments to our communities, and we develop a connection to country, in particular in our remote communities. And we note that some of our communities have a particular connection to country, and in particular Aboriginal and Torres Strait Islander communities. With respect to our Aboriginal and Torres Strait Islander communities, we note that they are often particularly exposed to the impacts of climate change, and because they are also more sensitive to other conditions such as cardiac and renal conditions, which are exacerbated by climate change. I'd like to reference the increasing incidence of heat-related diseases, food and waterborne diseases, vector-borne diseases, respiratory illnesses also associated, for example, with bushfires and dust storms, and other indirect impacts, as I said, on agriculture, for example, and primary production. So
30 seconds, mate.
Next slide. So really, we have a broad range of activities that we're involved in, and as Claire said, we're also involved, in particular, in collaboration with other groups. We'd like to support all global efforts and nationwide efforts to raise awareness of the impacts of climate change. We strongly support the National Climate Change and Health Strategy development, and we're champions of advocacy in our training of our next generation of rural journalists. Thank you so much for the time, and we're committed to collaborating with all of you.
Excellent. Thanks very much. It's definitely going to be an impact on rural areas with the climate impacts. So next we have the Australian New Zealand College of Anaesthetists, and Dr. Archie Srivatsa, I think presenting maybe from WA. Over to you.
Thank you so much. Hi, everyone, and thanks for this opportunity. I'm Achana. I'm an anaesthetist at Fiona Stanley Hospital in Perth, and I'm speaking from Whadjuk Noongar country. I'm also an executive board member for the ANZCA Environmental Sustainability Network. Today, I'm going to be speaking briefly about the ANZCA College work in the sustainability space, but I do want to acknowledge that there's a number of independent anaesthesia-led groups around the region who have led in this area, which is our trainee group, TRASH, of whom I'm also a member. In a nutshell, anaesthesia gases, drugs, surgery, perioperative care in general are a significant contributor to hospital-based carbon emissions and waste output up to 25%. And the majority of large healthcare facilities will offer some sort of surgical care necessitating anaesthesia, which I think is a pretty given. Fellows of the college advocated within the council, having recognised this, for the formation of an environmental sustainability working group to begin addressing this issue about 4 years ago, and a report and recommendations were generated in 2020 to help guide the college's future activities in this space in order to reduce the footprint of the college and to advise the fellows, trainees and guide further research and advocacy in this space. Next slide, please. The ESN was formed about 18 months ago. It was formed to help connect anaesthetists, trainees and other members of the perioperative team from across Australia and New Zealand, and to continue advocating and acting for sustainability initiatives within the college. So this has kind of developed that initial report into more of a broad, like-minded network of people. So based on the work that the Sustainability Working Group did, the College Council has supported greening ANZCA's internal operations as a college and setting the lead, setting some role modelling to members and fellows of the college, including prioritising structural change, including corporate governance, investment strategies and divesting, and staff empowerment, as well as reviewing some of the energy and emissions of ANZCA facilities and procurement and waste management practices. We've also pushed for reviewing practices around conferences and events, so including things like the annual scientific meetings to engage with venues supporting sustainable events, hybrid and virtual conferencing, and exploring some innovative avenues of event emissions reduction and carbon offsetting. Next slide, please. The work of the ESN has, in the last year, focused primarily on promoting sustainable practice amongst ANZCA fellows and trainees. And this has been divided into 3 portfolios, as shown on this slide. So advocacy, education, and research. We've prioritised engaging with members to develop professional documents to guide clinicians and healthcare facilities on environmentally sustainable perioperative practices, but also to develop consumer resources in order to empower our patients and their families to discuss the sustainability of their perioperative care. So not just anaesthesia, but the perioperative process in general. I'm sure you've all noticed patients often mention the amount of waste produced for simple procedures, and that's something that we are working on, both helping to empower patients, but also to help facilities and ANZCA fellows to start addressing within their own workplaces. Some of our board members include experienced researchers, and they've engaged with the college to promote both research and funding into research in environmental sustainability. Next slide, please. Our activities in the last year have included representation at the combined ESN and Mackay Anaesthetic Community Conference and the MAC conference held in Airlie Beach in June. And this was presented for the first time as a hybrid conference with a sustainability theme. Dr. Scott Maher and Dr. Rajesh Pachigo, who are both ESN executive members, helped to co-convene this, focusing on exemplifying local initiatives which can be taken to other areas and developed. We've also encouraged the college's endorsement of the RSCP research practice report into climate change and healthcare, which was released earlier this year. Next slide,
30
please.
seconds, Archie.
No worries. The ESN releases a quarterly newsletter to members as well to help with connection and networking, which showcases sustainability initiatives around the region and support members in submitting articles to the college quarterly bulletin. Later this year, we've got a few more things planned, mostly outlined on this slide, but we've got a forum planned in November to help with networking, and hopefully a busy and productive year ahead. And this is only a fraction of what's going on, just a few things that have been going on to help to improve our footprint as a college who fully acknowledges that the work we do directly impacts carbon emissions. Thank you.
Good work. Nice work from ANZCA. Thank you for that. So next we have Dr. Bob Bevan, President of the College of Intensive Care Medicine. Go for it.
Kia ora all. Thank you very much for the opportunity to contribute. My name is Dr. Rob Bevan. I'm the President of the College of Intensive Care Medicine of Australia and New Zealand. I'm a full-time intensive care specialist based in Auckland in New Zealand, and I think the scale of the problem has been very well framed. I think Nick Taylor made an excellent point in that those bushfires were felt far and wide, and we could taste that in the air in Auckland, and we can see it layered on our glaciers, which are ever shrinking in New Zealand. So I think that is a point very well made. Now, ICU as a specialty faces intrinsic challenges when it comes to climate change, I think with overlap with our colleagues in anaesthesia. Looking after critically ill patients is a resource-intensive activity. We have issues with our staff to patient ratios, which make for inefficiencies. We are heavy users of real estate, of machinery, of power, of gases, of drugs, infusions, plastic devices and consumables. And that seemed to us previously to be intrinsic to our practice, but we need to reflect on that. Over the last few years, we've all seen huge issues of infection control brought to the fore by this pandemic. And that has required expensive design reconfigurations, which have probably been counter to what we've been thinking about with climate change. And it's really concerning amount of single-use plastic that we seem to be getting through as this pandemic unfolds. Notwithstanding, at a beds per 100,000 rate that's much lower than most of the OECD, even in Australia, we have had to get used to being mindful of our resources and how they are used and choosing wisely. Next slide, please. So 2 aspects of the CICM initiatives really would be thinking about climate change as regards to our ICUs across the countries. And secondly, our organisation based in Melbourne. So focusing first on intensive care as well, we've had initiatives for ICU have been action from both of our professional bodies. The Australian New Zealand Intensive Care Society, who we work in tandem with as we're a relatively small craft group. We have had guidance from our college from the statement, which is now 3 years old, as you can see. And we've had close collaboration with ANZICS on a pragmatic guide to intensive care specialists where they work to what sustainability may look like in their ICU, although that's going to have to look slightly different depending on where they work. There's a rising voice, which is very welcome within our fellowship, to go further than just mere statements, forming a special interest group resource to meet and progress initiatives and to bring the best learnings from around the country back to the Fellowship Affairs committees, which feeds directly into our college board. We've incorporated sustainability into our hospital accreditation visits, which basically which are high standards that intensive care units need to meet in order to have trainees. And so units need to show us that they're thinking about this. We can gather pragmatic data through this as well to feed back to other units and publish that at our ASM as to what good looks like. Moving to paperless working within our ICUs, refuse recycling appropriately within our ICU, and we do have to use plastic, mindful practice during equipment purchasing and selection. And I think what may be increasingly important is to have an honest evidence-based approach in our collaboration with infection control services. Is it really necessary to use a single-use disposable plastic gown to approach the bedside? Is there an evidence base to that? So as an organisation, that's the second aspect. We too have felt very strongly that our banking and investment side of sustainability goes towards environmental sustainability and ethical ethical investments, and that's been pretty much over a year. And as an organisation, we are building a new building. Bringing sustainability and practices into that and developing, replacing sort of paper-based resources within our office. But Australian ICUs have witnessed direct and indirect consequences of climate change, not only locally with the bushfires, but also regionally as we support our Pacific neighbours as they too suffer the consequences of climate change. So I won't repeat everything that's on this slide, but there's an awful lot that we've already gained from being part of this webinar. So thank you very much.
Again, excellent to see. Thank you very much, Rob. So we now have Dr. Lara Oweski, who's going to represent the College of GPs. So over to you, Lara.
Well, greetings, John, and everyone from the Wurundjeri lands of the Kulin Nation, and thank you very much for the invitation to speak tonight. Our college has been in the advocacy space for some time now, and we consider our GPs the front line of the front line. Tonight, I'm just going to highlight some of the work that the college has done in the last year. Next slide, please. So we've created a range of resources to support our GP members. We have a general practice business toolkit, which gives advice about actions to minimise the environmental footprint that general practice can create. We collaborated with the Sydney North PHN to produce a series of climate change posters for general practice waiting rooms. And these posters allow patients to appreciate the impact of climate change on a range of physical and mental health conditions. We ran a series of webinars for GPs and practice teams looking at health impacts of climate change and also climate change and rural health. And released recently a CBT accredited GP learning module on planetary health. Our RACGP expert committee is looking at considering whether an element of our practices environmental sustainability could be included in a future edition of the standards for our profession. And we have a very active climate and environmental medicine specific interest group. This is a place for our GPs to network, advocate, discuss key issues, generate education. We have over 1,200 GPs that are members of the group, and a lot of the work that I'm presenting tonight has been informed and championed by the group. Next slide, please. These are 3 of 10 posters that we developed with the Sydney North PHN, and patients can actually access via the QR codes a series of further information that's relevant to their health and climate change. Next slide, please. So we have a position statement on climate change and human health, which was developed in 2019, and this continues to guide our work. In the past year, we have held meetings individually and collaboratively with a range of government ministers. We've written letters to national leaders and joined with other organisations, oftentimes to amplify key messages. We've supported the development and launch of the RACP's report, which I'm sure they'll speak to, so I'll say no more. And we've joined the Healthy Climate Future campaign alongside 9 other medical colleges. We're also signatory on the Healthy Climate Prescription, which called on world leaders to take action on climate change. Final slide, please. So our college has also been busy internally. We have hundreds of staff across the geography of Australia that are supporting our GPs. And we have a newly appointed sustainability leader. This role will determine, educate and advocate for and lead improvements within our business and also for the wider general practice industry. We've introduced an environmental and social governance investment policy, and this is providing guiding principles for our investment portfolio, and that's actually already resulted in a number of divestments across a number of investments, and we continue to be guided by this. We have made a commitment in November last year to a target of net zero emissions by 2040, and we have set ourselves an interim target which is embedded in our operational plan for 2022-2025 to ensure we stay on track. We've also created a RACGP Green Team, thank you, and that Green Team will continue to demonstrate leadership and allow us to engage with our members and with the college itself around our actions. Thanks very much, John. I'll finish there.
Fantastic. Well done. So good to see what your college is doing. It's really terrific. So Professor Lynn Madden, I think you're up next representing the College of Physicians.
Thank you very much indeed for the opportunity to speak about the Royal Australasian College of Physicians' work on climate and health, and I'm speaking from Gadigal land. Last year at this event, I spoke about our research report, which was launched at the end of last year, 2021. And this is the front cover of that report on this slide. And it also has the badges of all the 10 colleges that joined in that work. The RACP commissioned the report to examine the risks that climate change presents to Australian healthcare systems. It was my privilege to chair the Multi-College Advisory Committee, which brought the colleges together and guided this work. The final report presents the results from 4 discrete research projects, including a systematic rapid literature review of how health systems are responding to climate change, and also case studies from across Australia. The report was intended to promote evidence-based recommendations for Australian policymakers, health systems, health professionals, and the communities that they served. Slide 2, please. And there's no doubt that the report has well and truly achieved this and more. Based on the report's recommendations, the Advisory Committee of the 10 medical colleges continues to work together to deliver a strategic evidence-based advocacy initiative. Together, we've launched the Healthy Climate Futures campaign to advocate for the report's recommendations. In the lead up to the federal election, we shared consistent policy asks, messaging and imagery across our extensive combined networks, including through media, social media and direct engagement with members of Parliament. We added to the powerful chorus of other voices supporting climate action for health. And we saw the results of that collective advocacy effort borne out in the election results. The new federal Parliament now has many MPs who have committed to their electorates that they will take action on climate change, and we must work to both support and hold them to account. The RACP has provided the report to MPs with an interest in climate change and is meeting with a number of them. Our president, Dr. Jackie Small, recently addressed the Australian Health Protection Principal Committee, made up of the nation's chief health officers, about the report's findings and recommendations. We're also now turning our attention to the upcoming Victorian and New South Wales elections, and plan to mobilise our combined memberships amounting to more than 100,000 doctors by providing online tools so that they can show their support. Aside from our public advocacy efforts, the report is providing an invaluable tool for education. The case studies included provide very powerful stories. They illustrate and give a human voice to the challenges that we face as health professionals, and I really encourage you to look at them. So other actions, the RACP will be drawing on the report in the creation of an online learning resource for medical professionals, and we are also planning to update our policy statements, which are used to inform RACP responses to inquiries and requests in these areas. We continue to support other organisations also in their advocacy and initiatives where these align with our policy. The RACP leadership is completely committed to this issue. Our President, Jacqueline Small, recently said on Croaky, together as presidents of 10 medical colleges, we're calling for climate-ready, climate-friendly healthcare systems, and we're ready to be part of the solution. More colleges are joining this collaboration, which is fantastic to see it growing from strength to strength. The next slide, please. That was the slide I should have shown you whilst I was saying those things. And finally, I will just ask for the final slide. I encourage you to visit the website to find out more about the Healthy Climate Future campaign, and the RACP is a signatory to the communique. Thank you, John. We are much more stronger together, absolutely, Claire, when we're together. Thank you.
Absolutely. No, the college's been doing a great job, and it's a really fine report, that one. It's really worth everyone having a look at. So Emeritus Professor David Fletcher is next, representing the Royal Australian College of Surgeons. So over to you, David.
Thank you. I'd normally be speaking for Whadjuk country, but I happen to be in the Kimberley and Broome, and there are 6 traditional owners here. Surgeons, along with anaesthetists, are the greatest producers of the pollution that healthcare produces. So we have a particular obligation. Next slide, please. Yeah, next slide. Okay, so our journey began back in 2015 with the Sustainability Surgical Practice Committee. And what our priorities were was trying to deal with surgical variation. So we provided feedback to individual surgeons using funnel plots as to their costs, their fees, their complications, to try and change practice. In 2019 and 20, we formed the Environmental Sustainability Committee as well. We redeveloped the policy on the 5 Rs, reuse, recycle, etc. We lobbied the government alone and with others for climate action. No response, of course. Only 2 submissions we made, which was the bushfires and to DFAT, did we get a reply, which we had actually some major input into. Because we were too slow to respond, we formed the Health Policy and Advocacy Committee, which has a direct access to the Council Executive, so we can work much faster. Next slide, please. So this is the strategic plan of our working party. Leading change in surgical practice, research, internal advocacy, and external public advocacy. We're doing all of these to some extent now, and I'll illustrate to you on the next slide where we're at. Next, please. So in terms of education, we're doing webinars. We're publishing articles in the Surgical News, where we've got material on the website. The more important part we're doing now is to look at research life cycle analysis. And ASNEP-S, which is the research arm of the college, is investigating issues such as surgical drapes. Why are we throwing them out? Why can't we reuse them? And we're looking at equipment as well. We've joined with the colleges of surgeons in the UK, Canada, and the US, and we've just produced a document on the future of sustainable healthcare, where we're looking at the carbon footprint in the supply chains. And a document will be available shortly, which will provide our best practice. The strategic plan of the college, as from this year, now contains sustainable future of surgery as one of the 4 pillars. So it's built into our program. And I'm pleased to say that by October this year, we expect to have fully divested ourselves of oil, gas and coal shares. We signed the Green College Guidelines with the DA and the AMA, and this was accepted in June 2022. And the Melbourne College is undergoing a rebuild in which energy efficiency with solar panels, heat and cooling, water recycling and waste management will be a major component. So I guess it'd be fair to say that the surgeons are beginning to surge, but it will be quite some time before we've established this as common practice for every individual surgeon. But we're on the way. It's our obligation to do so.
Great. 30 seconds there, Rob. Oh, well done. Thanks. Great to see the college doing so much. That's really awesome. It's such an important area. So now representing the Royal Australian New Zealand College of Ophthalmologists is Dr. John McCombs. Go for it, John.
Yeah, many thanks for inviting us to come, and I'm talking from the Yumgoomba People's Lands. Can I have my next slide, please? We have a sustainability charter at the college that has been in effect for a couple of years now, and through that has set up a sustainability committee which guides our activities on this topic. And many of you will know the chair of that committee, Dr. Jessie Gale, and I'm a member of that committee. The major things we've been involved with are cataract sustainability practice guidelines and intravitreal injections sustainability practice guidelines. They're the two things that ophthalmologists, they're the most common things ophthalmologists do in Australia: cataract surgery and intravitreal injections for macular degeneration and diabetic retinopathy. And so we've developed practice guidelines that try and guide our fellows in the most efficient and less waste for these procedures. And the cataract one is fully approved and has been sent out to our fellows. And for example, in that we are recommending that drapes are only to the chest level rather than a full body drape, which is unnecessary, wasteful, and has no added benefit having a full body waist. That's just one of the examples of what we're recommending. The intravitreal injection guidelines we're in the process of developing, but again will be centred around minimising waste necessary to do these injections. We spend a lot of time trying to advocate this to our members, and at our National Congress last year we had a keynote address from Cassandra Thiel from the United States, who gave an excellent talk. And we communicate with our members through the Health and Wellbeing newsletter and College Magazine, trying to promote these guidelines that we've been developing. We became a member of the Climate and Health Alliance this year, and we were a signatory to the Healthy Climate Future Advocacy Program as well, like the rest of many of the other colleges on this webinar tonight. Coming up, we've got the World Ophthalmology Congress, where RANZCO will be doing a seminar promoting our guidelines again to reduce waste. And we'll be doing that at our National Congress as well. We're also running a workshop at our National Congress to help people interested in working out their carbon footprint in their practice and seeing various methods to reduce their carbon footprint. We have secured some funding from Roche that is going to be used to fund a sustainability project, and that's a competitive process at the moment we're undertaking to see who the best candidate for that funding is in Australia. At the registrar selection level, RANZCO runs a multiple mini interview part of the selection process, as many of you will know, that is used in other colleges as well. And we've introduced one of the questions this year was to do with sustainability and to assess the candidate's interest and understanding of sustainability issues. And that's very important. And at the college level, college administration level, we're again very conscious of energy efficiency whenever making any decisions around that level. And we did a fit out of our college premises, and very recently in the last few years that all of those energy efficiency things were taken into account. So that's a quick summary of what we're getting up to in the Royal College of Ophthalmologists. So thank you very much.
Terrific. Thanks very much. That's excellent. So next we have Associate Professor Vinay Lakra, sorry, Vinay, President of the Royal Australian and New Zealand College of Psychiatrists.
Thank you, John, and nice to be here with all our colleagues. As you can see, we are part of a number of collaborative initiatives. I am speaking from the Wurundjeri land of the Kulin Nation. It was quite eye-opening to hear Alex's presentation about low-value care. I also want to acknowledge a number of our colleagues. Some of them are there on the webinar today who are quite active in this space and also keep us active and keep us engaged so that we can take the action. I'll talk about a few things. So obviously, people have already talked about the mental health impacts of the climate change. We know about the increase in rates of anxiety, depression, and PTSD associated with the weather events. I think our colleague from rural and remote medicine quite rightly talked about that. There is also anxiety associated with climate change, particularly in young people. So there is concern about perceived and real inaction from those in authority in many of them. And of course, the indigenous people are at greater risk of experiencing environmental distress as they feel helpless to defend and protect traditional lands, air, water, and country. The other thing is that we work very closely with some of our Pacific colleagues in the Pacific nations, and it impacts quite significantly that group as well. Next slide, please. We've been doing quite a few things in the last 3-4 years. We've actually moved slowly publishing our journals online. So we published 2 journals. Both of them have now moved to being published online. We also declared a climate emergency, and that climate change action aligns with our strategy. In 2021, we endorsed the Australian healthcare sector emissions reduction targets. We've completed our divestment from all the fossil fuels. That was something we had committed to the year before, and over a period of 12 months, we've achieved that. We've also published a position statement on mental health impacts of climate change. We had a statement which was published a few years ago, and in December 2021, we updated that statement. Next slide, please. This year, we've joined the Climate and Health Alliance. We had our College Congress in Sydney, which was a hybrid conference. As you know, travels contribute quite significantly to the emissions, and so we're looking at a range of things, how we can continue to achieve the same outcomes by reducing travel. And so at our College Congress, which was a hybrid event attended by 1,500 people in person, but 500 people attended it virtually, which was quite a large number for us. We had a keynote speaker who presented on climate change and mental health, Tim Flannery, which was received very well. We had also a few other symposia at the Congress about climate change, and so they were received very well as well. We are currently updating the position statement addressing the mental health impacts of natural disaster and climate change related weather events. Next slide, please. We've also, in terms of our conference, we've kind of literally removed any sort of material from them. There's an app usually now. There's no published material. There are no bags handed to the delegates. So some of that work has been happening over the last 2 years and will continue to do so. We are also looking at many sustainability practices across the college. And so we've got a staff working group at the college who looks at some of these sustainability things, including, switching the lighting, recycling bins. We've switched to the electronic training records in the last few years to minimize paper usage. We're looking at usage of computers beyond their usual life. So some of that work is happening. And other renovations which have been happening at our buildings, which kind of is looking at sustainability and environmental impacts of that. I will end by saying that.
Vinay.
Thanks, John. I'll end by saying that we need to buy less, reuse more, and maximize recycling, and get rid of plastic where possible. Thank you.
Fantastic. Thank you very much. And so, last but not least, we have Associate Professor Diana Robinson, representing Australian College of Sport and Exercise Physicians.
Thanks for having me here tonight, and I'm coming to you from the Camaragal lands of the Eora Nation. The ACCEP sees that there are two sort of aspects of climate change that we need to look at, and that's broader population-based issues as well as SEM-based issues. We know that with increasing heat and other weather events, there's going to be a reduction of physical activity levels in the general population. When temperatures climb above 29 to 30 degrees Celsius, people tend to stop exercising outdoors. With repeated floodings, smoke, fires, and other storm events, people's accessibility to outdoor exercise is also reduced. And we've also got the issue of a loss of infrastructure from things like fires and floods. When people can't exercise outside, there's the affordability of indoor gyms, which are expensive. And so the people from lower socioeconomic groups will be more disproportionately affected. So a reduction in physical activity obviously leads to poorer health outcomes in the long term in both physical and mental health. At the sport and exercise medicine level, the impact on people's ability to participate or compete in their chosen sports will have the significant ramifications on their personal physical and mental health. There's also the risk of cancellation, poor attendance and economic viabilities to competitions and events as we increase as the heat increases. In fact, it's been projected that there would be 30 to 50 additional days of training by 2050, where people cannot access, that will have to be cancelled because of excessive heat. And with the increased exertional heat illness presentations, that will be affecting not just community-based sport, but right through to elite competition. So there's a really big need for us to advocate to the relevant national, state and community sporting groups to assist them in understanding the risks and how to mitigate these to undertake the sustainable practices. Can I have the next slide, please? So we know that sport's a casualty of global warming, but in fact, it's also a key contributor to global warming. There's many people traveling, officials, athletes and spectators, as well as building of infrastructure for large events. But it's also has a broad social platform to make it a very good strategic tool to promote awareness of climate change. Can I have the next slide, please? So in terms of the college, our next conference, our major initiative this year is the focus of climate change in our national conference in November of this year. We're putting quite a large portion of the college of the conference aside, a plenary session and workshops to engender enthusiasm for a committed climate change and sustainability working group. We are a small college and we are behind the 8 ball when it comes to work in this area, but we're trying to move forward quickly. We'll be promoting member discussion, and our aim is to create a position statement on climate change and sport and exercise medicine over the next 12 months. We've endorsed the RACP climate change in Australia's healthcare system document and a signatory to the Climate Futures campaign. Next slide, please. So overall, our aims moving forward is to identify environmentally sustainable practices in sport and exercise medicine and encourage our members to adopt these. The issues of climate change and sustainability have been embedded in the ACCEP curriculum already, and we are pitching for some funding from the STP education program to build an online module in climate change in SEM. We're building resources on our LMS to help educate our members and fellows, and we continue to educate the community on active, safe physical activity in a changing climate and the benefits of active transport. We are actively promoting research in the effect of climate change on sport and exercise participation and their associated risks, and we'll move to advocate to the various sporting organisations. And because we are a small college, we will continue to participate in joint advocacy and hope that those colleges will help us with ideas and resources. Thank you.
Excellent. Great. Thank you very much. It's really great. So there you go. What a whirlwind tour that was of 11 colleges. So thanks for everyone for pretty much keeping to time. That was excellent. So we'll just move on to some comments now from Dr. Kate Charlesworth, who's the Senior Advisor of the new Climate Risk and Net Zero Unit in New South Wales Health. Over to you, Kate.
Well, thanks so much, John. Hi, good evening, everyone. So I have the really unenviable task of trying to summarise and bring together the last 1.5 hours of comments and presentations. So I'm a bit of a hospital pass there. But firstly, I'd just like to make a couple of general comments, and then I have sort of grouped all of those responses into 3 areas, which I think sort of match our 3 tasks and those put to us by the Minister. So, I mean, firstly, I think it's quite an interesting observation to say that across all of those presentations, we're seeing this theme come out that climate change is a threat multiplier. No? It doesn't invent new diseases, but it exacerbates so many of the existing issues that we see. We've heard about skin disease tonight, about air pollution, about mental health impacts, right down to the impacts on sports and exercise. So I think it just shows the relevance of that. And of course, as the Minister said, Australia is one of the countries on the front lines of climate health impacts. And so, we really ought to be one of the best responders. I was quite taken by Professor Tully's comments, a pretty frank critique, I think, of the Australian health system's response so far. And his slide saying, talk, is this the best that health professionals can do? So I think there really it's pretty clear that we all now have a duty of care to respond to this, and to be doing everything that we can. And of course, you would have seen the medical editors in a recent editorial saying that the response that we need now to the climate emergency is similar in magnitude to what we had in terms of the pandemic response. So that's the sort of space now in which we're operating. And so then to group the comments that we've heard and all the presentations today, I think there are 3 key areas, 3 key responsibilities. The first one's about advocacy. We've heard a lot about advocacy. The second task for us is about mitigating the health system's carbon footprint. So that's about getting to net zero in every specialty. Okay? And then the third group of comments about adaptation. Okay? So firstly on advocacy, as the Minister said, which is really refreshing to hear from Minister, the good public health policy is good climate policy. And we know that doctors are among the most trusted and professional groups in society. Right? We have a huge amount of influence, not just in our workplaces, but also in our communities and in the media. And just as we spoke up on tobacco and seatbelts and a whole bunch of other issues, so we have a responsibility to do that. I was quite taken by Professor Tully's comment that 24 people die for every terawatt hour of coal that is burnt. Many of you would have seen recent research published by Harvard University that found that fossil fuel air pollution, that's air pollution from coal, oil and gas, is responsible for more than 8 million deaths globally every year, nearly 6,000 deaths in Australia. That's the same number of deaths as from cigarette smoking. So it's a clear role here for us in terms of advocacy. So it was great to see a whole range of advocacy actions being taken by a whole lot of the colleges, particularly I think from the emergency doctors. It's always good to see when the emergency doctors are saying this is an emergency. I think people really sit up and listen. So that was terrific. But also Claire Skinner's comment that we really need to now to have smarter and more targeted advocacy. Terrific to see a lot of the media statements and position statements from a range of colleges, and also those RACGP posters, which look really great, not only in awareness raising for patients and for the community, but also with those QR codes giving health advice as well. And I mean, really, I think the task for something like RACGP is to make sure that those posters are in almost every general practice waiting room in the country. You can imagine the sort of impact that would have. So yeah, and then finally, just great to see also that in a lot of, it's hard to be advocates unless you have your own house in order, and great to see the range of initiatives that colleges are taking within their own operations, and their own facilities and their own offices to get to net zero, particularly something like the RACGP net zero by 2040, and greening their own operations, the divestment from the intensivists and the psychiatrists, and I know that RACP and others have done that as well. So that's sort of my comments in terms of advocacy. The next area is about really getting the health system to act together. And there are a lot of comments about and a lot of actions in terms of education and research. So again, really good to see that sustainability is now being incorporated across webinars, conferences. There are resources being developed, there is training, there are learning modules, and there is research in a number of areas. I guess my overall comment on that is great. It's a good start. It's necessary, but it's not sufficient. Okay. The next thing that we really need to do is think about how we get to net zero in every service and in every specialty. Okay? So if you're working in rehab medicine, or if you're an anaesthetist or in dermatology, the question for you is, how do I deliver a net zero health service in a low carbon world? How do we continue to provide quality healthcare in a low carbon world? I think there are sort of three key principles there of the sort of in our approach. Okay, and these are the principles of sustainable healthcare. This is developed out of the UK. The first principle is prevention. Okay, and that's because one type of carbon neutral health system would be a system in which we didn't have any patients. Okay? Everyone was healthy and well and independent in their homes and their communities. Okay? So that's just in recognition of the fact that so many of the things that so many of us and our colleagues do every day to keep people healthy and well are actually sustainability initiatives. So that's the first principle. The second one is about reducing low value care and harmful care. And we saw that illustrated in Professor Barrett's presentation this evening. Could save more than 8 million tonnes of carbon by reducing low value care. All that low value care has harms and risks for patients and also costs, just financial costs, but carbon costs. Okay, so that's the second principle. And then the third principle is, okay, where we do have effective evidence-based care, how do we decarbonise that? And that's about what type of inhaler we use, what type of anaesthetic gas we use, and so on. So if we sort of apply that principle, then I think there were some great actions that we saw sort of highlighted tonight. Obviously positive comments from ASIM, from RACS about their role in reducing low value care, and some great toolkits, sustainability metrics from ASIM, the Beginner's Guide to Sustainability in ICU, the RACGP toolkit, great things to see. Really encouraging also to see that some of our biggest polluting specialties, so ANZCA, the surgeons, intensive care and so on, really starting to take this on as a specialty, recognising their responsibility in this and taking ownership for that and really progressing things as a specialty. Good to see, in particular the surgeons beginning to surge. So that was pleasing. And then I guess I just wanted to tie that in. Great work with the surgeons, carbon footprinting of supply chains, life cycle assessments, and RANZCO on the sustainability practice guidelines, looking at cataracts and intravitreal injections. So I think that's really encouraging, really progressive work, quite substantial shift from last year. And I meant to preface all of that with saying that Minister Butler, great to see Minister Butler saying that we've got an overall sort of climate policy, but now they're starting to look at sector specific decarbonisation policies. So every sector, transport, energy, agriculture, everyone's going to have to get to net zero, and him recognising that we're a significant polluter as a sector. And so we have a role to play there. And then finally on adaptation, this is of course equally important. Even if we stopped polluting tomorrow, there would be climate changes baked into the system for decades to come. So we will need to be prepared and resilient for that, as Minister Butler said. Unfortunately, as Professor Talley said, we're not at all prepared at the moment. We don't even have a climate and health strategy. Of course, the government's now committed to that, which is great. But there's a huge amount, of course, for us to be doing in this space. ASIM noted 12% increase in ED presentations during extreme heat. How do we manage that, given there are already the pressures in the system? And an important point here that was made by a number of colleges, particularly ACRM and ASIM, about the disproportionate impacts on vulnerable communities, on rural and remote communities, children, babies, the elderly, low-income communities, and so on. So about addressing our adaptation response with an equity lens on it, recognising the current inequitable distribution of climate health impacts. So that was on adaptation. And then finally, I guess just a few closing comments. I've got here, actions speak louder than words, which I guess ties in with Professor Talley's comments. Sorry, I'll just finish up, John. realizing, and I guess, you know, we realize here that we're preaching to the converted, you know, all the people on this line today are working in this space, but I think now there's a real opportunity to really scale up our response, given the urgency of the situation, and also the changing situation. Professor Tully noted the Greener NHS program. That, of course, is led by an Australian doctor, Dr. Nick Watts, an extraordinary response there. But of note, that program is strongly supported by the colleges. Now, I have college presidents on breakfast TV defending their sort of clean air policies, talking about the importance of net zero ambulances and response vehicles. There are colleges there who are stepping up and putting up sustainability fellows, you know, putting aside, you know, funding their registrars to take a year out or half a year out to focus on net zero in their specialty. So there's a huge amount, I think, here that colleges can do to support sustainability units. We understand that they're looking at a national unit. Of course, there are a number of state-based units. I lead the New South Wales Health one, but it's critical, I think, that colleges have that role to play in supporting their state units and their health departments and their hospitals. And then just my final point was the importance of us working together. As Professor Madden said, there's more than 100,000 of us, more than 100,000 doctors if we all work together. So we should be able to do something with that. Thanks, John.
Oh, thanks very much, Kate. Once again, you've done extremely well to summarise a busy agenda. Sorry to throw you that hospital pass, but you've pulled it off. Well done, thank you. So obviously we were going to leave some time for questions, but really to stay on track, I think we'll have to postpone that part. Thanks everyone for staying online, of course. There were so many good questions, such diverse issues, you know, divestment, agriculture, diet, you know, our own carbon footprints, low value care, etc. So we could keep the discussion going all night, obviously. But I might hand over now to Eugenie Kayak, who's the previous chair of DEA, who is going to wrap up for us. Thanks, Eugenie.
Thank you, John, and thank you everyone else. And very sorry that we haven't had questions. I'll try and be very quick to keep to time. I was going to talk about next steps, though I think Kate has summarised a lot of that brilliantly. I'm coming to you from the land of the Wurundjeri people of the Kulin Nation. So we've heard tonight numerous times that we need to act and we need to act now. And that's what the communique that's going to be released tomorrow points out very clearly. And Nick Talley and others have done tonight as well. But what does action look like? I'd suggest that it is us leading the change we want to see. As we've heard, we need to be part of the solution and not part of the problem, and get our own house in order. Doctors have agency, and collectively we really are a powerful voice when it comes to action on climate change and other public health issues. So the first thing is, well, to speak up, but also to speak up and advocate. Secondly, I'd like to invite you all here tonight to really be pushing for and supporting significant emission reduction targets this decade. As mentioned, the AMA and DEA and ANMF have all officially supported emission reduction targets by 80% by 2030. And if you look on the DEA Making Healthcare Sustainable site, we have a page there which we would like to invite colleges and other institutions and hospitals to also add their logo to. By supporting significant, ambitious, audacious emission reduction targets this decade, we're then sending a clear message to governments and policymakers in industry that we all need to collectively act. And I know someone's also put in the chat DEA's proposal for a national sustainable healthcare unit. We need state and national units to help us coordinate action. We can do some of this in silos, but we'll never get there quick enough if we all do this separately. Coordinated action and also coordinated benchmarking of measurements. We're really not actually measuring very well at the moment what our problem is, and it's hard to change if we're not measuring. Also to have coordinated roadmaps like they have set out in the NHS. So I also suggest that we all need to be supporting state and national sustainable healthcare units. The fourth point is to work towards electrifying everything. Hospitals can be fully electric. The new Melton Hospital in Victoria will be, Canberra Extension, the new Adelaide Children's and Women's Hospital will be electric and run on 100% renewable energy. And DA on their website also has a guideline for medical professionals to advocate for their next hospital to be all electric. We need to ensure this is happening across the country. Our colleges have really stepped up, and I think it's imperative for all of us to support them and our institutions to keep acting in this space and to become bolder. And we've also got a guideline on our website, a Green College guideline, to encourage this. And they do it, colleges do it, membership organisations do it when their members ask and insist for change and leadership. And finally, but not least, of course, is education. Vital. We need to educate the present and future doctors about how to manage climate change and health adverse impacts, but also how to practice sustainability in the environment we are heading towards. So we need to act now, and there's been a poster put up quite aptly. DA's conference that's being held in 2.5 weeks has the theme Time to Act. Some fantastic speakers, health professionals, but also far wider, economists, engineers, political scientists. It's held in Melbourne, and it's can be you can register online to attend in person or online. And I encourage you all to do that. Become part of this community. And the week after that, Coda Change is also being held in Melbourne. They have a Coda Earth theme on the 12th and 13th of September, with a plenary with fantastic speakers like Kate Charlesworth and Forbes McGain and Nick Watts in person. So that's another one to look up. Coda Change also has Coda Earth actions, so interactive actions that doctors can get involved in, which look at meter dose inhalers, anesthetic gases, and pathology testing. So strongly suggest that those that are interested also look at that website. So thank you, everyone. We've heard many, many times tonight that we need to step up and we need to act. We can't wait another moment. The planet and humanity depends on it. We need to avoid the unmanageable, as Tony McMichael used to say.
Thanks very much, Eugenie. And I think so for some final words, Steve Robson, I think you're still here.
Yes, absolutely. Thank you so much, John and Eugenie. I want to thank all of the presenters tonight, all of the facilitators tonight. I want to thank each and every person listening and joining in and watching tonight. And I also want to thank the AMA team who put on a fantastic technical side to this webinar. So thank you so much to the team there, and keep an eye out for the communique that's coming out tomorrow. I was elected AMA president about 10 days ago, and it is a position of some responsibility, but it does give me quite a prominent voice in setting the health agenda. And I tell you, climate change will have health effects on a scale that people are barely able to comprehend. So climate change is very much in our lane. We're already seeing a series of rolling health crises around the world, but these are just the beginning. We face the prospect, if we don't do something, of literally billions of climate refugees across the planet. A crisis so enormous that it's almost impossible to grasp. So I think that as a profession, we have a responsibility to do everything we can to bequeath a healthy planet to our children and their children. And as president of the AMA, I seek a strong and united coalition for action here, because I don't think we've got any time to lose at all. I want to thank everybody tonight and wish you well.
Thanks very much, Steve, and thanks everyone. Good night.